So you're considering starting an antidepressant, but you're wondering, do antidepressants really work, and will they actually help me? Well, in this video, I'm going to be answering these questions. Okay, so this question has caused some debate in the medical community, and researchers used to say that only about half of the antidepressant trials in the FDA database showed that antidepressants were more beneficial in treating symptoms of depression than placebo. And this is important, especially when 1 out of 10 Americans aged 12 and up are taking an antidepressant medication, because no medication comes without the potential of side effects. So if we're going to be prescribing a medication to you, we want to have evidence that it's actually going to help. So in 2018, the Lancet published a comprehensive review that included 522 double-blind studies and over 116,000 participants. Let me repeat that in case you didn't catch it. 116,000 participants. And after evaluating 21 different antidepressants, they concluded that all the antidepressants studied were more effective than placebo in treating adults with major depressive disorder. And this is especially true when we're treating the most severe forms of depression. There's multiple studies that show evidence for this and back this claim up. Not only that, antidepressants have been shown to achieve higher rates of remission and have been shown to help prevent relapse of symptoms. So now that we know that antidepressants are effective when compared to placebo, the next question to answer is whether or not they'll help you with treating your symptoms. Before we dive into answering this question, make sure to check out the link below if you want to download my free antidepressant beginner's guide, because in this, I answer your most common medication questions in addition to breaking down the pros and cons of the top 10 antidepressants that are currently being prescribed today. So if you're looking to feel better faster, this is definitely something that you'll want to take a look at. Now, in order to fully understand whether or not antidepressants will be helpful in treating your symptoms of depression, I first want to talk about some of the common terms that are used in psychiatry when discussing treatment efficacy. We refer to these as the 5 R's. The first term I want you to know about is response, and this is when someone who is being treated for depression gets at least 50% improvement in their symptoms. And this used to be the goal of treatment, but now we are aiming for remission, and this is when you become symptom-free. If you remain symptom-free for at least 4 months, then you are in recovery, and this is beautiful. Now, what happens when symptoms start to pop back up again? When your symptoms return before you reach remission, or within the first few months prior to achieving recovery, then you have relapsed. And if symptoms pop back up after recovery has occurred, then the term we use is recurrence. So the 5 R's are response, remission, recovery, relapse, and recurrence. Okay, so now that we're all speaking the same language, let's answer the big question. Will an antidepressant be helpful for you? Well, one of the most popular and largest antidepressant studies ever conducted was the STAR-D trial. And one of the main goals of the study was to figure out the remission rates of depression, right? And remember, remission means symptom-free after treatment. And what this study suggests is that your chances of achieving remission with the very first medication you try is somewhere around 37%. Okay, so now you're wondering, what happens if my first medication doesn't work? Do I try a second medication? And the answer is yes. This study took those who didn't achieve remission after their first medication and then either started them on a new medication or added on a helper medication. And then this process was repeated for a 3rd time and then for a 4th time if needed. The good news is that with each treatment course, more and more people were able to achieve remission. And by the end of 4 treatment courses, almost 70% of people became symptom-free, and that is freaking awesome. Now, the downside is that the odds of beating the depression with medications alone decrease with more medication changes that you need to make. And this is especially true after 2 medication regimens have failed. And this is part of the reason why treatment-resistant depression is defined as 2 antidepressant failures. Now, it's important to remember that just because some people didn't achieve remission, it doesn't mean that they didn't have symptom improvement. So I don't want you to get discouraged with this. It's estimated that around 50% of people will respond to antidepressant drug treatment. meaning that we'll see at least 50% symptom improvement. Okay, so you might be wondering, why do we care whether or not someone achieves remission, right? Shouldn't getting a response and overall symptom reduction be good enough? And the answer is no. Symptom reduction is not good enough. The more symptoms still present and the more treatment failures you have, the lower the chance you'll have at achieving remission. Not only that, data shows that you'll also have higher relapse rates, so we really want to intervene as soon as possible and try to get you to be symptom-free, because this might prevent disease progression. This is an important point to understand, so if you need to, go back and listen to this again so that you can hear it and process it another time. So now you might be wondering, which symptoms are most likely to persist and continue to be present in those who aren't completely symptom-free? The most common ones that linger and have a difficult time going away are insomnia, fatigue, pain complaints, cognitive problems including poor concentration, and lack of interest or motivation. What we see is that treatment of major depression seems to work best in improving symptoms of depressed mood, psychomotor slowing, and suicidal ideation. So now that you know what to expect when starting a medication, the next thing you need to know about is how to select the right antidepressant for you. Make sure to click that top video to find out.